And we will bring you more on that story very shortly. But we need to take you to India now, where the pandemic could be having a damaging effect on the spread of another potentially deadly disease. The number of people being taken into hospital for tuberculosis has fallen by more than 35% this year. And experts fear that means thousands of cases could be going untreated, with the danger the disease could start spreading again. Nitin Shrivastava from BBC Hindi reports.
An end to the lockdown brought relief for Pankaj. He was finally able to have brain surgery to stop the spread of tuberculosis in his nervous system. But this life-saving surgery turned into a nightmare because the drugs to treat TB ran out.
Any interruption in TB treatment means loss of life. I can't tell you what happened during the harrowing time. No one in my family could sleep for 5 nights. I am 41 and have twins. There was a worry that they may get infected due to me if my treatment got interrupted.
His wife and family tweeted everyone, from civil society to the government, for help. Any gap in treatment can cause a relapse or for TB to become drug resistant.
It's been a long struggle for TB patients in India to get hold of basic medication and to continue their medication. What's more worrying is the number of dropouts, people who are considered missing now because the treatment has stopped due to the pandemic. The biggest fear now is that they also can transmit the disease in their communities.
India has the highest death toll from tuberculosis in the world. About 500,000 people die every year.
I think we are still very far away from elimination. My concern today is that are we going to lose the gains that we've made in the last 10 years? Because India was gaining in its fight against TB, and now with the arrival of COVID-19, I suspect we may be going further back than we were earlier.
And there has been a drop of more than 35% in the number of patients reporting to hospitals for TB treatment since the start of the pandemic.
The public system is still 100% managing COVID or worried about COVID. Private sector has become more difficult to access in India. It's become more expensive. There are fewer clients being seen in the private health sector. So I'm worried that an average Indian with TB or with any other disease is now caught between two bad options.
Most TB patients in India depend on the state for treatment. Only a few like Pankaj have access to private medical care in bigger cities. The government claims to be on track to eradicate TB by 2025, but its challenge has just got bigger. Nitin Shrivastava, BBC News, Delhi.